Feelin Fab is more than another wellness podcast. We will talk about topics that also include happiness hacks, biz inspiration, how-to topics, and interviews from experts in many fields. We hope to help you navigate your life with some helpful tools and tips to keep on grooving and staying happy. Welcome to the Feelin Fab Podcast, and I'm your host, Marissa. Hey listeners, welcome back to the Feelin Fab Podcast. We talk about things that help us feel awesome, but we also talk about educating ourselves and learning more. And today I have a very special guest for you. I have my friend from high school, Dr. John Clayton. He's a doctor now. And Dr. Clayton is awesome for so many reasons. First of all, he's really good at music, which is how we met, but he's also really good at being a chiropractor and recently started his own practice. So today I wanted to talk to him a little bit about what exactly chiropractic care is and how to choose a good chiropractor, how to find one that's a good fit for you. And I'm hoping that Dr. Clayton can just help us learn a little bit more about the mystery of chiropractic care. Welcome to the show, Dr. Clayton.
Hey, thank you, Marissa.
You're so welcome. It's good to have you on. So I'm very excited to talk to you today. Tell me a little bit about how it was going to chiropractor school.
So I went to school in California in the Bay Area. The school I went to was Life West, and
Cool.
It's a 3.5-year program, and it's pretty similar to medical school, except the residency is like a clinical portion where you adjust patients and care for them as if you would in practice.
Awesome. And you enjoyed your time in school?
Yes, it was very hard, but it was very good. A lot of late nights and a lot of studying, but it's paid off.
Yeah. Well, that's awesome. So when we were friends, I mean, we still are friends, but when we were friends in high school, I don't think at the time you wanted to be a chiropractor. I think you did want to do something related to health, wellness. So how did you come to the decision that you wanted to be a chiropractor? When did that happen for you?
So my first pick, I guess, was either between a veterinarian and like a general surgeon, somewhere in there. And I guess the major difference for me was I wanted to be in a kind of a different setting than a hospital and be able to help people get better and have them actually enjoy going to the doctor versus kind of dreading it. And I think that's kind of where the balance, or I guess the difference with chiropractic is that patients get better and patients enjoy going to chiropractors and they feel better almost immediately versus a surgeon where it takes weeks or even months to recover and to enjoy the benefits of what they do.
Ooh, I like that. That's awesome. Yeah, I would categorize, and correct me if I'm wrong, but I would categorize like chiropractic care in more of a proactive type of wellness. Would you agree with that? Or do people come to you when they have something like seriously life-threateningly wrong?
I think in a lot of ways we are more proactive. If it comes to like emergencies or anything, we are usually the people that most of these people will not go to because they think that their emergency is so big that they need to go to the hospital or the emergency room. So luckily, I mean, we are trained to do some emergency stuff and to diagnose or whatnot if we need to. But most people will just jump ship and drop themselves off of the ER rather than the chiropractic office.
Yeah. And I think it definitely depends on your situation, but I think it would definitely be less expensive to probably see your chiropractor first. But yeah, totally depends on the situation and what's wrong. But I will say that once I had like a terrible sinus infection and I was about to the point where I was going to go to like an urgent care or something because I just felt like I wasn't getting relief. I actually had a chiropractor appointment. I called him and I was like, hey, I think I have sinus infection. Like I'm probably not contagious anymore because I've had it for a few days, but I don't know if I should come to my appointment. And he was actually like, no, come on in. Like, I actually think that I have some things that might be able to help you. I was like, okay. So I gave it a chance and he adjusted me. And it was actually so helpful for my sinus infection, which is something that I wouldn't normally relate to chiropractor care. But I found it so interesting. And he kind of explained to me a little bit about how our body systems are all like intertwined and interconnected. So sometimes we can solve problems just by adjusting certain things. So I'd love to have you share a little bit more about, the body as a whole and maybe some things that chiropractic care can help with that other people might not expect it to.
Okay. So chiropractic really in general is the care and maintenance of the nervous system. And really what that comprises of is the entire body. Everything is controlled by the nervous system. And so when we go in as chiropractors and adjust the spine, or in my case, I adjust the spine plus the extremities, basically every other joint outside of the spine is what I generally look at as well. We can basically help the nervous system to work better because it gets little kinks in it here and there. And I guess a good example of one of these kinks would be, you twist your back and it hurts. That's a big kink. But there's these little kinks that go on every single day. They're caused by, stress or, injuries, whether it's, physical activity or even emotional stress can cause these kinks in our nervous system. And so we go in there and we're trained to find these kinks generally in the spine, and we adjust them, and they help to kind of clear that pathway for the nervous system to work better. Kind of, you can imagine like a kink in a hose, and then you unkink it, the flow is better. It's the same process with the nervous system. So by doing these things, we help people to, just live a better life in general. And there's countless stories of how it's helped people, but generally, you can just think of us as doctors of the nervous system. And I guess we're kind of more mechanical when it comes down to it versus any other kind of component that other doctors look at.
Oh, that's awesome. I love that. Doctors of the nervous system. That's great. So cool. I actually had a few questions from some of the listeners. So I'm going to shoot a couple of those at you and we'll get some good answers. So the first question I have is it safe to continue chiropractor care while you are pregnant?
Yes, that is an excellent question. One of my favorite things about chiropractic in general is that we can see anybody. We're not just limited to, like geriatrics or babies or whatnot, is that we can see within our scope, tons of different people. And pregnancy is one of those things. And I think it's one of those things that is definitely overlooked by the population of how much chiropractors can help pregnant women. So just as far as what I do is I have a specific table at my office in which I can adjust it to make a pregnant woman comfortable without having to squish their stomach or the baby, so that they know that they're safe. And the cool thing too is that with all the hormones that are released during pregnancy, is that the body is actually much easier to adjust, and so your adjustments are a lot more gentle when it comes to being a pregnant woman versus just a normal care patient. So I guess some of the benefits too that I help teach my patients about is when I'm adjusting a pregnant woman, I'm not really doing anything to impact the baby. As far as I'm not doing something directly to the baby, I'm doing stuff that helps the mother, and in turn, it helps the mother's body better prepare for the birth of that child. So examples are ligament releases. There's extra tension in the ligaments that are holding the uterus. I help release those, and then biggest thing is the pelvis, and making sure that the pelvic bowl is properly suited for that baby to come out. And a quick story: one of my pregnant patients, she just gave birth about a week and a half ago, and she was under care until the COVID-19 went down, and she missed about 4 weeks of care leading to her birth, but her birth, just with as much care as we did, just a few visits, she got her labor down to 2 hours. So that was pretty awesome.
Okay, that is so cool. I think that that is sounds like something that would be very helpful for a lot of women during pregnancy and labor. I think there's a lot of fear. I mean, I haven't been pregnant yet, but I think there's a lot of fear that can come. So any kind of reassurances and things that we can do to help prepare our body, I think would be awesome. I have another question kind of along the lines of pregnancy from a friend. She asked, does getting adjusted help with infertility?
Yes, that's a great question. The best way to kind of address this is to say that, there's a lot of reasons for infertility, especially for a woman. And I guess the one that chiropractic can really help address, we can't, let's say there is a difference between sterility and fertility. I don't think we can really help sterility as much when it comes to fertility, though. One of the biggest things that the human body does is if your pelvis is not lined up properly, especially like your sacrum bone,
Mhm.
like your ilium, which is like the hip bones, I guess. If there's a misalignment through there, and that your body deems that you're unsafe to create a child in there, because it would either kill the mother, or create a problem for the mother due to having a growth in that area, the body will just say, no, we're not gonna do that. And so by fixing those misalignments of the hips and the subluxations is what we call them, of the sacrum and the pelvis, we can really help to make sure that that area is suitable to have a baby grow there.
Oh, that is so fascinating. So cool. So, okay, my next question is, how often should someone see a chiropractor for it to be effective?
That's a great question, and I've really been trying to stress this with a lot of patients that I've seen so far, is that ultimately the biggest thing is whatever your needs are that the chiropractor has addressed, they're going to give you most likely like a care plan to follow. And that care plan is suited to you as a person, most likely or hopefully. And so you have to follow that care plan for that to work. But generally, if you're just coming in, you're saying, I want to be as healthy as possible, there's nothing really wrong with me. I just want to get the benefits of chiropractic. I would say that you'll see the benefits even with just coming in once a month. But if you can come in at least twice a month, that would be probably the most optimal. And then once you are, truly dedicated to your health and, being active and all these things, kind of the nutrition part of it and everything, if you can come in once a week, that would be like the most effective you can do. But I would stress just once a month, just for, getting started and making sure that it's not a major impact as far as financially on you
Mhm.
as it can be.
Awesome. That's great advice. I've also heard the, like, what do you call it? I've also heard the analogy before that, our bodies, we can kind of think of them as cars. So it's really important to make sure you're getting your oil changed and your tires rotated and doing all these things so that your car, runs the best that it can. Because you don't want to all of a sudden have a tire fly off on the side of the road one day. It's better to prepare and prevent than to have emergencies happen. So I love that we can come in once a month or twice a month. And I think you can definitely decide that with your chiropractor, just like you said, depending on what's going on with your body, if you're just wanting some general maintenance or if you're working on some things. But that is a great advice. All right. My next question is chiropractic care safe for infants and small children?
Yes. So the the cool thing about having infants and babies adjusted is that their adjustments are so gentle compared to even like the most forceful adult one. And I think that was the biggest scare for like one of my brother-in-laws was, are you going to adjust my child as hard as you adjust me? And it's like, no, no, definitely not. And I showed him, I was like, this is how much pressure I would actually use. And he's like, oh, okay, go for it then. And it's like, oh, okay, So that was your big concern. And so really when it comes down to it is um, for babies, when you adjust them, especially when they're, less than a month old, all we are really concerned about as chiropractors is their pelvis, how well that works, because that's going to be a lot of their digestion and basically their ability to poop, and then also their ability to hold up their head and do head movements, and I guess have the best possible nervous system as possible by adjusting the very top bone in their neck, the atlas or the C1. Those are the two areas that we only really look at as chiropractors for babies. And then once kids get 3, 4, 5 years old, that's when we can start addressing more of the spinal issues that can happen. But in general, it'd be a great idea to have children and babies see chiropractors, because that in the end, that chiropractor is going to know that child throughout their entire life and be able to help prevent things that could possibly occur later on, possibly even like a scoliosis, or any kind of malformation like that of the spine, or the body in general.
That's awesome. That was also my follow-up question is, do you think it's important for kids and, developing bodies to have chiropractic care and to get adjusted? So so your answer would be yes.
Yes. It's funny because there's always that analogy that kids are rubber and they fall down a lot and they just get back up and go, and it's like that is true to an extent, but possibly later on all those bumps and bruises could tie into their adult life. And so it is good to have them checked, because they are so much more active than we are, and they can still suffer from the same malalignments of the spine and the nervous system, but they're not going to show as much of the negative effects of it as an adult would.
That's awesome. So, do you think most chiropractors have like some sort of like family plans or something that you can do if you're wanting to get your whole family seen? Like, can you bring people all at one time, or how does your office manage that, at least as far as maybe a mom who's bringing in her kids type of perspective?
Yeah, so I treated, when I was in school, I had a family of 6 that I would see, and it was just fun because everyone got to take their turn, and um, yeah, it was smooth. And I think the kids just have to bring, if there's a lot of kids in the family, they just have to bring something to entertain them. But I mean, they shouldn't be there longer. I mean, depending on how big they are, but I mean, stay there for maybe 30 minutes tops, get everyone adjusted, and then they're out of there. So it's really not that long when it comes down to it.
Yeah, especially because, it's not quite the same as like a doctor's office where you wait in 3 waiting rooms before your doctor can see you for 5 minutes. So I think that it's nice because you don't have quite as big of a burden at your office. So people probably aren't waiting as long, get in and out pretty relatively fast as far as their appointments and everything goes. So yes, I think that's awesome. Okay, and then my last question from a friend that was submitted was, can an adjustment ever be a bad idea?
Yes, I would say some adjustments can be bad when it comes down to it. If you don't do a proper exam as a chiropractor, let's say someone comes in, they say, "Hey, I got in a car accident," and you don't really ask all the questions that you need to figure out what's really going on. Car accident being probably the biggest example is that someone could suffer a fracture in their neck, and you don't know it. You can maybe guess that they do have one, but then you do need to take X-rays on that. And I think it's scary to not have um, X-ray units in chiropractic offices. A lot of these franchise businesses, the big ones that everyone kind of hears about, they do not usually X-ray. And so really what it comes down to is if you walk in there after a car accident and they say, "Okay, that's cool, let's give you an adjustment," and then you have a serious side effect that changes your life or that ends your life, they're not liable for that, because you sign the paperwork that says, whatever happens, it's my, I take responsibility. So in that way, yes, if there's a pre-existing thing going on, such as a fracture or whatnot, and the chiropractors don't x-ray, that can be a serious issue. Other than that, I would say if you get adjusted every day, there's really no need for that. And so that's when you could say that's just too much for the nervous system and that's not necessary. And you're not doing yourself any good by doing that unless you're having, the most serious of cases that needs to be adjusted on a daily basis. But that is very rare.
Awesome. Great information. So if somebody was, in a car accident or had, I don't know, maybe a ski accident or something athletically related, you would just recommend that they either go get an x-ray from the doctor first or try and make sure that their chiropractor can x-ray them first, or what would you suggest for the best route?
So I guess the best route is if you're going to be getting chiropractic care, to just have your chiropractor X-ray you and check it out. And I guess if it's a serious enough case, then the chiropractor most likely won't adjust you that same day. They'll review your X-rays, make sure everything's solid, and then they would have you come back the following day to perform that adjustment. So it'd be as soon as possible, or even later on that same day. But it'd be pretty scary to come in there and just get an immediate adjustment,
Mm.
um, and have some kind of side effect that way.
All right. Well, that's great for us to know and keep in mind. My last question for you, John, is so I know that not all like insurances and things like that cover chiropractor care. So is that ever an issue, or is there usually some sort of like payment plan or things that your chiropractor can set up with you? Because I know a lot of people are like worried, like, oh, I can't go to the chiropractor because it's not on my insurance.
Yeah, yeah, and I think that's almost the big reason why people either do or don't go in the first place is if they have those benefits on their insurance for chiropractic. Um, I guess as far as looking at it from a chiropractic perspective, as the chiropractor, um, people should not be basing their care and their body's health on their insurance. And really what it comes down to is, and the sad part about it is that the insurance companies really don't care about you as the person. And so, if you really need that good of care, from a really great chiropractor and they're not on your insurance, I wouldn't even hesitate to go see that chiropractor and just work out some kind of cash thing with them. And when it comes to seeing people with insurance, especially nowadays, is that, I charge usually $40 for an adjustment. I'll get people in here that have $35, $40 copays. So it's like you're paying $40 to to me as a copay, but your insurance, it really isn't doing that much anyway. So why are you even using insurance in the first place? So it's
Mm.
just something that I think people have to kind of explore on their own and see what their benefits are, or just have the chiropractor, and the staff there figure that out for them and let them know, like, hey, you really don't have that good of benefits, or you haven't even met your deductible, so that you're basically paying cash anyways. So, and people just don't realize that, and that's the sad thing about today's day and age with insurance companies.
Yeah, it's very complicated. Yes, for sure. So I'm actually someone that I just choose to pay cash because that's just easier for me. And yeah, I don't think it's too big of an expenditure either. My chiropractor, that I mean, everybody's different, but he has like a punch card where I can buy like so many sessions at a time, and then I can just use like my punch card as I go. So just make sure to ask your chiropractor. Like, don't be afraid to ask questions. I'm sure that they're willing to help you because at the end of the day, your chiropractor really wants you to feel well and wants to help and serve you. So just make sure to ask questions. I know that insurance and things like that can be very confusing. All right, John. Well, thank you so much for some great information on chiropractic care. Is there anywhere that you would like to tell the listeners that they can head to find your business and learn a little bit more about you?
Yes, so I'm on social media. I'm on Instagram and Facebook under the name Supra Chiropractic. So yeah, if you want to just follow that, I do plan to post more videos and things in the future as we get going, and I'd love to answer questions, anything that anyone has there. And luckily nowadays you can actually book an appointment on social media for some businesses, and so I do have that option on my Facebook. If you want to book your appointment through that, you can do that as well.
So cool. And that's Supra Chiropractic. I will have that in the show notes as well as the blog post. So you can head over there for any links and stuff like that to check out John. But also, his business is local to Layton, Utah, correct?
Yes.
So if you're local to Layton, Utah, and you need some chiropractic care, please go give Dr. Clayton a call and set up an appointment, because I'm pretty sure that you have some sort of a discount for new customers. Is that right, John?
Yes. So anyone basically that comes on through social media at this time will get 50% off their first exam, or I guess their initial exam, and that's just something that's special to this time, especially as we're getting started and everything. So yes, 50% off first exam, initial appointment. If you basically call or just say that you listen to Marissa's podcast, or you looked us up on social media.
Awesome, guys. Make sure to take advantage of that because it's great. All right, John. Well, thank you so much for the information. And like I said, I'll have everything linked in the show notes and in the blog post. So if you have any more questions for John, you can contact him on social media. But, at the end of the day, we just want to remind you to feel your best, and that life is not meant to be, just agonized through, and that you can have a higher sense of being and to feel well as you go throughout your days. So you can take little steps and little adjustments to make that happen. Oh, adjustment, no pun intended. All right. Thank you, John. We'll catch you next time.
Cool. Thank you, Marissa.
Hey, bye-bye. Thank you.